Okay, so are you having knee pain, so much so that you think you might need a knee replacement? Well, there might be an alternative for you that you want to check out first. Dr. Zach Parker is the education director for the Amarillo Regenerative Medicine Center. He joins us today with more. All right, so this is kind of a cutting-edge therapy. A lot of people talking about stem cell therapies, right? What can that do for knee pain and kind of the prevention of a knee replacement?
Yeah, absolutely. The exciting thing about stem cell therapy is because it can help not just with knees, but shoulders, hips. It actually helps to regenerate the joint. Most everything that we do in medicine to treat joint pain is a degenerative model. So we've got medication to kind of mask it or decrease the inflammation. We got steroids to try and kind of mask the inflammation again, or we have to go in and actually do a knee replacement or something, you know, major surgery of that nature. But all those are kind of degenerative models. We're taking something that's not alive, trying to change what's going on. Regenerative medicine with stem cells is exciting because it can actually help regrow your own tissue, help regrow and replace the tissue that's there, and stem off these surgeries, knee replacements, hip replacements, things of that nature. It's real exciting. You know, up to this point, you'd hear about it in the past, and people would be traveling out of the country to go get stem cell therapy. They'd be, you know, mostly movie stars or, you know, professional athletes that were getting it done. And even now, you hear about it here in the United States, and someone's traveling to Florida or to California to get it done. But now it's available right here at the Amarillo Regenerative Medicine Center, and it's exciting to see. We were talking about just a second ago, the patients coming in and seeing the improvements they're having, and so many of them. I was fixing to go get that knee replacement.
Yeah.
You know, if I didn't see your stuff, I was calling to get my knee replaced. I'm so glad I didn't do that because I feel great now and I can do everything I was doing before. So,
I mean, the science is new. The science is, I mean, there's still a lot of research to be done on stem cells and regenerative medicine, but you are seeing some concrete results in your shop, right?
Absolutely, absolutely. And it's, while there's, I say, the research has been going on for quite some time. There's some questions about how long it lasts and how good it lasts for, because we haven't had time to see it come to
Long
the
term.
end. Yeah, absolutely. But you know, following the principles of what's actually happening and how it's happening in the body. When you rebuild, you're able to rebuild the cartilage in the knee. You're able to regenerate the tissue, whether it be a tendon or a ligament or bone or whatever's damaged in there. Then that tissue is new, it's long term, it's regenerating, it's healing, and so I tell patients, you know, for the most part, it's probably going to outlast you.
Yeah.
It's younger than you are, so it's going to last a little longer than you. But it's amazing the types of results we're seeing, and the like I said, again, it's the knees are the most common thing.
I was going to ask, yeah.
That's the most common thing people come in for because knee replacements are so common. But like I said, hips, shoulders, ankles, really any kind of joint issue. Problem is we're living a lot longer and we're outliving our joints.
Yeah.
We're wearing them out before, you know, and so this is actually a way to help us turn back the clock on those joints, get, you know, help reduce the pain, rebuild the joint, and do it in a healthy way. So not only do you get rid of the pain, you can mask pain with a pain pill.
Right.
You get a heavy enough dose, you can mask any kind of pain, but you don't gain function back. This, you're able to actually reduce the pain, get function back, get strength back, see changes, and get to back the quality of life that was taken rather than
Makes a lot of sense.
Yeah, than just get rid of the pain. So.
I'm sure that's really exciting for you to be able to help people like that.
Oh, it's fun. It's very rewarding
Yeah.
to see, you know, where people are at and to hear where they're at now and how much better they're doing and how excited they are about what's next.
Yeah, for sure. Okay, people out there watching, maybe they have questions. What can they do?
Well, they're welcome to call the office. We do have a consultation, and we've for those Studio 4 viewers, if they call in from watching the show today, we do have a discounted consultation for them. If they're interested in stem cells, want to find out if they're a good candidate. It includes x-rays, it includes information about it. And we're doing that right now for Studio 4 viewers for just $49 if they'd like to do that. We also, if they'd like to just learn a whole lot more about what stem cells are, what types of stem cell treatments are best for them or might be most applicable, we hold seminars regularly, educational seminars on stem cell therapy, and if it might be the right thing for them. If they just call the office, it's 410-6584, I think.
That's on the screen. Yeah, there you go. Good job.
410-6584. But if they would just call the office, they would tell them, they could point them to the next seminar if they'd like to come learn a little bit more that way as well.
Sounds great. Lots of information out there. Thank you, Dr. Parker. We appreciate you.
Absolutely, you bet.
All right, stick around after this. We will be right back.